This is Dr. Varsha Kulkarni from District Pune, District Coordinator of Pune Branch, IIPWC. I, along with my teammates, Dr. Sureshri, Dr. Ankita Dalreja, and Dr. Saili, extend my warm welcome to the first ever session which we are going to release of the Physio Talk series. We are honored to have a dynamic personality over here for this session, Professor Dr. Suvarna Ganveer ma'am. She is the Vice Principal, Professor, and the Head of Department of Neurophysiotherapy Department at DVVPS VFS College of Physiotherapy, Ahilya Nagar, India. It has been affiliated with the Maharashtra University of Health Sciences. She requires no formal introduction, though I took my privilege to introduce ma'am. Ma'am has been crowned with more than 25 years of her academic practice. She is a certified ICF trainer, Dutch WHO FIC, the member Primary Care Group, World Rehabilitation Alliance, IFNR representative. She also has been awarded the Best Teachers Award by MUHS in the year 2024. She is a BOS member of MGM University and Bharati Vidyapeeth. Academic Council member KVV Karad and MGM University, Mumbai. She is a chief editor, Journal of Indian Association of Physiotherapists, editorial board member, received many innovative awards, and she has been definitely going to help us out and giving her excellent knowledge and the expertise on today's topic, that is dementia in women. So I would like to invite you, ma'am, and help us out to know about this wonderful topic, dementia in women. Hello,
Thank
ma'am.
you so much, Dr. Varsha.
Hello. Well, ma'am, we know the word dementia, and it has been popularly nowadays in the common has become the common term also. Ma'am, could you please help us know about what do you mean by dementia? Help us know about what exactly are the signs and symptoms what we can see in dementia.
Right. Thank you so much, Dr. Varsha, for the question. And I'm delighted to be a part of this Physio Talk series. My voice is not so good today, so please excuse for that. So dementia is it is a progressive decline in the cognitive function that interferes with the activities of daily life and primarily characterized by the problems with memory, thinking, and behavior. And dementia and Alzheimer's disease are, coined simultaneously. I mean, they are the words which are used interchangeably, and people usually believe that, Alzheimer's disease and dementia are one and the same thing. But Alzheimer's disease is a sort of a subset of dementia, you can say. There are a lot of other causes of dementia other than Alzheimer's disease. And since it is the disease that affects the memory of an individual, which is the characteristic or which is the primary feature in the activities of daily living, the person's quality of life is deteriorated to a great extent, because right from first task in the morning till the last task in the night, one requires memory. And if the memory is not there, or if there are issues with the memory, then the person is not able to function according to his age, according to his status in the society, or his role in the family. So the quality of life is affected on all aspects of the person's behavior. So that is in short about dementia. You are on mute, Dr. Varsha.
Is dementia more commonly seen in males or females? And does this progress very much faster in the females.
Yeah,
I
over a
know.
worldwide, women have got a higher risk of dementia. Um, it is said that the biological factors are more responsible for dementia in women as compared to men. Probably because as such the dementia is more common in the elderly individuals, and because after menopause the estrogen levels are reduced in women, it becomes all the more you know sort of a triggering factor in women. So it is said to be more common in women, and partly because it is also said, I mean, the literature says that because the women tend to live longer as compared to men, the dementia is also more commonly seen in women. Besides this, it has also been documented in the literature that because of um, lesser exposure to the environment, or probably lesser awareness, or lesser impactful activities of women in the society, probably that is also one of the reason for having dementia in women, especially in the rural areas. So yes, women have got a higher risk of dementia.
Okay, so in this society again, it's like women's first, and women's are getting the higher aspects in
Ladies
dementia
first.
too.
Yeah.
Yeah, actually. Well, when does dementia as it start in women, and how are the deficiencies actually getting linked up with dementia? Can you please little elaborate, because you already mentioned about the hormonal changes and all. Can you please explain it a little in detail regarding the deficiencies which are linked up with dementia?
Okay. So, as we all know, dementia is probably more commoner in the elderly age group, and because of the menopause, the estrogen levels are reduced, and estrogen is directly linked to the bone density, and because of which it leads to osteoporosis and the deficiencies such as reduced bone density. The levels of estrogen has got all its effect on the heart muscles also. So that is also one of the linking factors as far as the dementia is concerned. So the overall health of women is at risk once the dementia hits, and considering the quality of life that gets reduced, the overall mobility of a women also gets restricted, which has its own effect on body, and because the mobility is reduced, it has its own effect on the mental health also. So it is like the vicious circle, one thing leading to the another, and hitting back again on the first aspect. So
Okay.
that's
Thank you, ma'am. Ma'am, and why are the women more likely to develop dementia, as you said already? So, any incidence rate or something which has been seen in the prevalence studies? Can you please share some case study related to dementia?
okay. So according to the literature, it is somewhere around 7.4% of prevalence rate that is seen in India as far as the dementia is concerned, and women are said to be more affected by in terms of around 20 to 30% more as compared to men as far as India is concerned. So these are the numbers that are given in the literature. But the rate can be still more higher because not all cases are reported, or maybe not all cases are noticed, because the lot of elderly individuals stay in the geriatric homes where probably the screening is not done. We do not know whether they are getting affected with this dementia or not, unless and until the screening is done, and probably the healthcare measures does not reach to those people. So, having said that, the uh, the prevalence of uh, having dementia in women is 20 to 30% more as compared to men.
Okay, ma'am. Ma'am, as you said that the elderly and those people who are into the rural areas, so definitely the environment is also having an impact on dementia. Like the dementia causative factor could be also the environmental causes. You mean to say, ma'am?
There can be, but there are no studies that are done, I know, as far as the rural and urban demarcation or effect of the rural setup is concerned. So there are no literature studies that are done. So probably those studies can be taken up and to find out, what can be the possible scenario as far as the rural and urban setup is concerned or the effect of environment is concerned. It can be both. I mean, the hypothesis can be in both ways. That in the rural areas, probably the women are, more or less confined to their houses, so they're not getting more opportunities to interact with the outside world. Or it may be that they have a healthier lifestyle, and the chances of dementia are less. So we do not know. So the hypothesis goes in both directions. So, but that can be one of the area that can be explored with the longitudinal studies in the rural and urban setup.
Okay, so this would be definitely one of the study what we can pick up,
Yeah.
ma'am, from
Yes.
your approach. Ma'am, actually, there are different behavioral signs and symptoms what is been noticed. So, how can we actually find out that a lady is going to suffer with this particular dementia problems in an early stage? Because later it is so out of the hand that we cannot even control the people on even the oral medications and also how can we actually screen out in the earlier stages? Are there any peculiar signs which can be noticed and we can give the approach?
Right. We cannot predict as far as, as to who will be the victim of dementia. It is very difficult to predict that, this person or maybe these are the risk factors which can predict, which will help us to predict the dementia. But yes, screening can always be done. And there are a lot of scales that are available for screening for the dementia. The only thing that we need to take care is that these screening test needs to be done on a regular basis, especially somebody who is, suffering with some kind of physical ailments, because physical health and mental health are interrelated. So, if somebody is getting affected with the physical health, probably the screening needs to be done, on a regular basis. And the common test that we usually use in our clinical setups, like, mini mental status examination or Montreal Cognitive Assessment Scales and MiniCog. These are the few very commonly used scales. The only care that we who are working in India needs to be more aware about is whether the license to use those particular scales, I mean, whether it is freely available or we need to buy the scales. That is something, which we need to take care of. But yes, these are the simple screening tools which does not require much of instruments or equipments. Simple question answer based screening test can be done, and we can find out if the person is at the risk of, I mean, are there any chances or signs and symptoms of dementia.
Okay, ma'am. How can we as such delay any kind of demential problems? Are there any supplements or the vitamins or something which actually can, as we all are of the same community, so what precautions as such we can take so that we can God forbid, and nobody should be having this dreadful problem. But definitely, how can we take the precautions so that we will not get into our lives?
It is a very tricky question. Uh, I don't think there can be a preventive measure, but preventive measure for dementia as such, because um, there are no set equations, like there are no certain predictive factors, that would say that this person would develop dementia, like how we have risk factors for stroke. So we can say that a person who has got a high blood pressure, or maybe who is at a risk of heart diseases, probably who has got obesity. So these are three, four definite risk factors for stroke. So for dementia, unfortunately, we do not have those kind of risk factors. But yes, since I'm a physiotherapist, I would concentrate, or I would emphasize more on the physical health. And I would always say that the physical health and mental health are interrelated. The person who is more physically fit, more um, healthy as far as his physical health is concerned, uh, may tend to have, or may have lesser chances of developing mental health issues. So probably the more you keep yourself physically fit, and you keep yourself, mentally engaged, probably that can be one of the key to prevent dementia. But there are no certain preventive measures that we can take as far as the dementia is concerned.
Okay, ma'am. So as such, we have to take care of our physical health definitely, which will have an impact on our mental health too. Uh,
Right.
as per our talks, definitely we got a brief knowledge about dementia, and also how we can definitely go throughout our life, how to keep ourselves mentally fit, being physically fit. Ma'am, would you like to conclude with anything specific with the dementia?
Yeah, I think the way I said that, the physical health can help to reduce the chances of dementia. Similarly, the person who already has got dementia, probably some kind of physical exercises can help him, to um, take care of his mental health also. So in patients with dementia, physical exercises, simple physical exercises should be started. It's not that it just because it is something which is related to the mental health, the physiotherapy exercises cannot be or should not be given. In patients with dementia, some form of physical exercises, simple exercises like balancing exercises, or maybe some kind of a strengthening exercises, in which the patient needs to remember the movements of the body. And because that is something which the patient see all the time, his own body he sees all the time. So probably if we give some exercises in the form of bodily movements, probably that would help him to undergo the recovery process of dementia in a in a little better way, or maybe it will ease out or soothe out uh, the detrimental effects of dementia. So we should give some kind of physical
Ma'am,
exercises
nowadays,
to these patients.
the brain gym exercises are much more
Yeah.
prevalent in our
Yes.
society. So,
So
is it helping out with the
yes,
patient's dementia, ma'am?
it can help out. It will definitely help out. But again,
And I think this is
um,
again a research topic to be done, like setting up of the protocols of brain gym exercises along with the traditional exercises and find out about the effect of it.
absolutely, absolutely. Brain gym exercises have been proved to be effective in elderly individuals, but not specifically in improving the mental health. So yes,
Okay.
that can be taken up as one of the research study. Yes.
Thank you so much, ma'am, for this wonderful insight on the topic dementia in women. Hope we all will find out some new things, as ma'am has definitely lightened up many research, small things. So we will work on this particular topic too, ma'am. Hope
Right.
you all will like the lecture, and we would like to have many more feedbacks. Thank you so much, ma'am, for giving us time and enlightening on this particular topic. Thank you so much.
Yeah, thank you so much, Dr. Varsha, and for inviting me as a part of IPWC activity. I'm delighted to be a part of the team. Thank you so much.